Hello, everyone. Now, most of us are familiar with Doppler technology being used to predict the weather. But today, Feigenbutz is here with Saguaro Surgical to tell us how it also can be important for our health, which, Eric, we have already been talking about this, and I've been picking your brain. So interesting, by the way. I'm so glad that you're here. Can we start out kind of just generally what is Doppler technology? I know we see it kind of with Aaron and April, but you're going to give us a great definition.
Absolutely. Thanks for having me, by the way. Doppler is just like the radar. So it's in the weather that sends out sound waves, looks at clouds and wind, and those sound waves comes back at a different frequency, and that's called the Doppler shift. We use the same programs in our ultrasound machines to watch different blood flows in your arteries and veins. So we look for a frequency shift in the machines that we use.
And that's how we're using that same technology, but for our health.
Exactly. Same technology, same as a train. So if a train's, when you're a kid hanging out by the train tracks, if the train's coming at you, the sound is at a higher frequency or a higher pitch than it is going away. That's the Doppler shift as well.
And can I tell you, when you said that to me, I said that clicked in my brain. It's a real life kind of analogy of what we'll be seeing here. So we're talking about you're talking about the blood flow. So how does this technology kind of help in diagnosing if we have something going on with our circulation?
Sure. We look at circulation like tubes. So we have tubes of arteries and veins in our body, and the blood flows through it away from your heart and towards your heart. There can be blockages inside of these tubes, cholesterol buildups, and we need to know if that blood is going normal over those blockages or not. They can really affect the patients and the symptoms they may have. Abnormal tubes or blockages in those veins and arteries can cause swelling in your legs, discolorations of your ankles. It can cause your legs to have restless legs at night, cramping in your legs when you walk long distances. There's lots of symptoms associated with bad veins and arteries, which we use the Doppler shift and our machines to look at.
Interesting. Now, when we're talking about circulation and our body, is it the same throughout our body? Because I know we have a video that's going to kind of show us, but is it the same?
Sure. It's not the same. So we have arteries that take the oxygenated blood away from the heart, and we have veins that bring the deoxygenated blood back to the heart.
Okay.
There can be different disease processes or problems with both, and that's what we're looking at, is either arteries or veins based on the patient's symptoms.
And I know we're also going to be looking at healthy versus unhealthy veins. What are you looking at to decipher which is which?
Sure. We look at the direction of the blood flow. We look and see how much blood flow is flowing through that particular area. Are the veins larger than they should be? Are the valves working correctly? Is there a plaque or a cholesterol buildup in the arteries to cause all of these symptoms or specific symptoms, and we know how to hone down and look at those particular vessels.
Well, now that we know kind of what you're looking for
Sure.
In there, now the actual using of the technology on someone, does it hurt? What's the process? Do we need needles? What goes into that part?
Sure. So ultrasound, the way we use it, there's no pain at all. We may use a machine just like this with a transducer, just like on babies when you're pregnant.
Okay.
But we use the ultrasound right on the leg, right on the stomach, right on the neck. There's no radiation, shots, or dyes with this, and that's the nice thing about ultrasound. You can have ultrasounds multiple times without any biological effects on the person, which is fantastic. Also, the quality of the ultrasound we provide can really reduce the amount of other testing doctors need to order to get the complete diagnosis. And that's the great thing with us over at Saguaro, is we can give such a fine detail amount of information that oftentimes other imaging modalities are not needed.
And is that why that's so important that this is available at Saguaro?
Absolutely. You bet it is. You know, there's different qualities of ultrasound. There's different amounts of ultrasound or testing that patients can get, and we try to provide the best possible. We work hand in hand with surgeons, and the surgeons will get back with us and talk to us about where we could have done better on a particular case.
Okay.
And at that point, we can review our images and everything we presented with them to make ourselves better. It's what sets us apart, is the continual side-by-side working with the physicians and making sure we're doing the best job possible for the patient.
Well, and of course, we're very lucky that Saguaro Surgical is here. It's available to us, and we can have this technology at our disposal. What about if we live outside of Tucson?
Sure. So we do provide service to other communities in southern Arizona. We go to Benson and we go to Nogales. We have clinics set up there that we're there every other week. So it's great for the people on the outskirts can come in and not have to travel clear into Tucson for their testing.
And I love that we learned a lot today. We know that what it can find, the very pinpoint like you were talking about, and that there's no pain, nothing, you know, kind of special. Any of us that have been pregnant or have had an ultrasound, we know it's just something pretty simple, but a lot can be told. Eric, thank you so much for coming in. This was so interesting to learn about, and I want people to be able to take advantage of it.
Thanks very much for having me.
Oh, absolutely. Now, to learn even more about Saguaro Surgical, please give them a call at 520-318-3004 or visit saguarosurgical.com.